the second chapter of Beyond Boundaries with Homeopathy 360. Yesterday we had with us Dr. Ajit Kulkarni, and today we will be talking to Dr. Manpreet Kaur. She is Professor, Department of Pathology, J.R. Kisan Homeopathic Medical College, that is in Rohtak, Haryana. She is also the Vice President of Delhi State Chapter of National Association of Palliative and Integrative Medicine. Palliative care for Ayush and integrative medicine. I'm so sorry. She has also contributed a number of articles to Homeopathy 360. Welcome, Dr. Kaur.
Good evening to all.
So I was so looking forward to this conversation. Today we'll be talking about routes of drug administration in homeopathy. This is because not many of us pay heed to this particular topic from the organon, and particularly with reference when we have reference to the organon, and we will be talking about Hahnemann's approach towards prescribing of medicines and drug administration particularly. We will also be talking about what are the conditions of prescribing homeopathic medicines, and whether or not there are precautions associated with this particular aspect of homeopathy. So, Dr. Kaur, over to you.
Thank you so much, Dr. Rashi, for this wonderful introduction. So let's begin without any delay. So the topic is routes of drug administration in homeopathy. And as we know that we commonly know the basic routes like olfaction or oral route, but there are 5 routes actually for the drug administration in homeopathy. So before beginning, definitely I must keep in mind the gratefulness of my teachers on me, how they have always guided me, especially Dr. Pankaj Agarwal sir, who has been my guru in all my ventures till now. So with these words and seeking blessings from my guru, now I would like to start the presentation. Now, as we all know, this is about brief about what is homeopathy and how we go about with the cures. So, homeopathy is an alternative system found by Dr. Samuel Hahnemann and based on the principle similia similibus curenta. But this method is for selection of the remedy. Now, how we administer the remedy through different routes, that will be the main focus of discussion today. So we administer our medicines based on 3 basic principles: the law of similia, the law of simplex, and the law of minimum. As we are all aware about it, similia means let likes be cured by likes. Then simplex means that we give a single remedy at a time. And law of minimum says that we give minute doses, which avoids any unwanted aggravations. So this is all basic, we all know about it. So I'm just skipping the finer details of it. Now homeopathy involves holistic care with mind, body and the spiritual vital force. So the homeopathic medicines help us to fight against diseases by assisting the body's natural ability, and then it provides relief for the symptoms of illness, and no suppression is there if a correct way of homeopathic medicine is administered. Now, our therapy is always individualistic and holistic towards the sick individual, and we, as a doctor, we do not treat the name of the disease. Rather, we treat the patient who is suffering from a particular disease based on individualization and holistic approach. Now, regarding this was about principles how we administer. Now few just in brief about the preparation, what methods are used in preparation of medicines. So preparation of homeopathic medicines is done from various sources like animal, plant and mineral kingdom and other natural substances by dynamization or potentization, as we all know it. Potentization is a serial dilution process involving succussions, which is vigorous shaking, to raise the inherent curative power of the drugs to the maximum. The inherent power is aroused and it is utilized for the cure of the patient. Now, the more number of times this process of dilution and succussion is performed, the greater will be the potency and lesser will be the concentration of active ingredient in the finished medicine product. Now, through these processes, the potential of the medicines to combat the ailments is increased and toxicity is decreased. So this is a very, very scientific way of preparing our medicines, and it is of basically two kinds: trituration and succussion. Potentization is of two types. For solid substances, but it is for the liquid substances it is through succussion, and for the solid substances it is through the trituration process. Both are methods of potentization. Now we come to the topic in focus, which is administration. Now,
Dr. Kaur, I'd like to stop you here. Regarding these two methods, the titration and succussion, the methods of potentization, we're not going into too many details about that because we believe everybody is aware of the basic
so
pharmacy and
yes,
everything. So,
yes, yes.
we'll proceed
Further,
forward.
yeah, yeah, yeah. So administration of homeopathic medicines is done in the form of liquid, in the form of globules, or in the form of topical products, powder, or tablets. Then there are even homeopathic medicines which are prepared as syrups, lozenges, eye drops, medicated powders, capsules containing powder or pellets. For all these, and most of these, I should say, alcohol is the vehicle. It is an excellent preservative also, and also a vehicle for our homeopathic medicines. Now, homeopathy bears with homeopathy bears a speciality and originality in the field of medicine about its route and mode of administration. So, the subject dealing with the route or channel of administration of drugs is termed as pharmaconomy. Now we go into the details about the different routes of administration. The usual mode, which is most common, is the oral route, and other alternative routes are also adopted as per requirement, like the olfactory route, which is inhalation through the mouth or the nose, then application to the skin, then application of medicine through the milk of mother or wet nurse, or through eye drops or ear drops, etc. About these I will go into the details. These are the 5 basic routes of administration of homeopathic medicines. Oral route, as we know, ingestion through the mouth. Olfaction is inhalation through the nose or mouth. Then application through the skin, which is by rubbing or friction, or in that also there are two types, epidermic and anepidermic. Then application through the milk of the mother or wet nurse, which is most peculiar to homeopathy. No other system tells about this method of administration. And the fifth one is through the eye drops or the ear drops. Now, one by one, I will discuss each of these routes in details. First, we talk about the oral route, which Hahnemann has emphasized in aphorism 272. Now, this is the most common method. With the pics, it's very, very demonstrable how we take the medicine orally. I have already inserted some photographs along with the type of route. So by oral route, medicines act effectively and promptly, and the potentized medicines require no digestion and are absorbed directly from the mouth and then through the cerebrospinal or the ganglionic nervous system. As we all know, our medicines act through the nervous system and not through the blood route. फिजियोलॉजिकल एब्जॉर्प्शन जैसे एलोपैथी में होता है कि दवाई खाई और ब्लड के थ्रू मेडिसिन एब्जॉर्प्शन ज़्यादा रहता है, वैसा हमारी पैथी में नहीं है. आर मेडिसिन आर showing the effects through the nervous system. So for an enhanced effect, the medicine can be dissolved in water, and the more the quantity of water you take, better it comes in contact with larger surface area of the sensitive nerves or over the skin or the the mucosa, the oral mucosa in the mouth. If you are taking through the mouth, then it is the more water you take, the more surface area of the oral mucosa it comes in contact, and the GIT, esophagus, stomach, and more will be the better effect of the medicine when it is dissolved in water and then taken through the oral route. So a single globule is crushed with sugar of milk, dissolved in water, and then it is stirred well before every administration, and it is a powerful method. It makes the medicine more powerful, more effective. The greater the quantity of fluid which you take, the better will be its effect, because the medicine will come into contact with a larger surface of sensitive nerves responsive to the medicinal action. Now, this is a reference from Aphorism 272, 6th edition, where Hahnemann tells about this. I'm just reading the red portion which I have highlighted from the aphorism. Like Hahnemann writes in this aphorism that a similar globule crushed with some sugar of milk and dissolved in a good deal of water, with reference to another, that is aphorism 247 also, and stirred well before every administration, will produce a far more powerful medicine for the use of several days. So one method is to just place a globule on the tongue, and another way is to dissolve this globule in water and then you take it through the oral route. So this method of dissolving in water makes the medicine more effective, because when you are taking a dry dose over the tongue, less number of nerves are touched, but when you dissolve the same dose in water, more number of nerves are touched and medicine shows a better effect. Now, there are few precautions with the oral route. Like we always tell our patients also to avoid touching the globules with fingers or hands. So the easiest way to do this is to gently shake the medicine dram, and gently shake the required globule or tablets, and then you take the few globules in the cap of the bottle and then place it on over your mouth, over your tongue, and then taken. Like I've just written in short that easiest way is to gently shake the required globule or tablets into the cap of the container and use that as a cup to gently place the medicine in the mouth. And this should be done because the medicine is absorbed onto the surface of the globules, and any moisture on the finger or hands may release the medicine at the point of contact rather than in the mouth. So if you are touching the globules, it may spoil the it can contaminate, or it can spoil the medicine which is already stuck over the globules. So it's better not to touch the globule and just pour the globules into the cap of the bottle and directly put it in your mouth. And better method is to dissolve in water and then take it. Like I usually tell to my patients for this method that थोड़ा सा पानी ले लो, उसके अंदर dissolve कर लो 5-6 globules and then take it. So at times some patients are not convinced because it takes 5 minutes to dissolve, but then it is a better method. So we always guide for that. Now, in addition, any oils on the skin, like our hands are not, very, they are not very sanitized, or, they are not free of any other pathogen or
Bacteria,
anything.
germs, everything.
Yeah. So we always tell them to not to touch. So any oils on the skin or any contamination on the skin may stick to the pellets or the globules, and this can impede the proper absorption of the medicine when you are putting it in the mouth later. So it's not recommended to touch the globules. And for a better buccal absorption, it is generally suggested that medicines should be taken with a clean mouth. Like we always tell them to take it empty stomach early morning, and even before brushing, or even if they have brushed their mouth, then after half an hour, when the mouth is clean, then they can take it. The mouth should be clean, and it should not be having any strong flavors, any strong mint or menthol products which are generally there in the toothpaste or all. So we tell them to either take the medicine empty stomach just after they wake up, or after brushing. They can take it half an hour after brushing or 1 hour after brushing, so that the mouth is clean and not having any strong flavors. Now, so taking empty stomach is more beneficial, and they are typically, medicines are preferably taken on empty stomach unless otherwise indicated, or there are some contradictions, like patient tells us that they are already taking some blood pressure medicines or thyroid medicines in the morning, so we tell them that okay, you can take it later on after a gap of few moments, like 1 hour, half an hour. We just tell them to take our homeopathic medicine after a gap, after they take their usual regular medicine of blood pressure or thyroid. Now, oral route, there is another part of the oral route, that is sublingual administration. That is letting the pellet or globule dissolve under the tongue rather than chewing it. Like I have already pasted some photographs of this route also on this slide. So, sublingual administration is adopted in cases of coated tongue, which interferes the absorption and action of medicine. Just a second, my excuse me for the pause. Am I audible again? Am I audible again?
Hello. Yes, ma'am. You are audible.
Yes.
Hello.
Am
Yes,
I
ma'am. You
audible?
are audible. Yes, ma'am. You are audible.
Okay. Okay. Thank you. Thank you. Okay, then I can continue. Right. So, in the sublingual administration, this method is adopted in cases where the tongue is coated and it interferes with the absorption of the medicine. It interferes with the absorption and action of the medicines. So, in such cases where the tongue is coated, we can use this route. And another is for local action, gargles, which are a solution of drugs for local action in the mouth or throat, can also be used. Now, homeopathic medicines should be placed under the tongue of the adults and children, or in the cheek of infant, where they will be dissolved almost instantly. So in the children it is less common because children are not they are having difficulty, but you can definitely use this method also in case of adults. Even in the sublingual route, the medicines are absorbed quickly when placed under the tongue. Now, forms in which the medicines are administered through the oral route, that is solid form. So, in solid form, we can give the medicine in medicinal globules, sugar of milk, or tablets. And in the liquid form, medicines may be administered after being dissolved in some water or liquid vehicle, so that it comes in contact with a larger surface area of the sensitive nerves, as quoted by Hahnemann in aphorism 286. Next route is the olfactory route, which Hahnemann has very well emphasized in aphorism 248. Now, this method also has a history. Hahnemann has used this method, which you call as Nasyam, as one method of administration in his later years. Now, there is an authentic record that this method was used by Jivaka for catharsis in the treatment of holy person as Lord Buddhaji in 623 to 580 BC. So this is an old method. It is not a very new one. It has been there in the history. The medicine was put on lotuses, which was considered as holy flower. And what is very amazing is the exactitude of the effect, as smelling each handful of lotuses produced 10 motions. Like the medicine was put on lotuses and then olfaction was taken. And this was a method adopted for the treatment of Lord Buddhaji by Jivaka. And Jivaka is a famous physician and surgeon of the 6th century BC. He was a physician to Lord Buddha. And this reference is from History of Medicine and Contribution of Hahnemann by Dr. Diwan Harishchandji. So this the method of olfaction has been in the history of medicine. Now Hahnemann tells about this olfactory route in aphorism 284 of 6th edition, and he writes there that besides the tongue, mouth and stomach, which are the common routes of administration, olfaction and inhalation through the mouth can be taken. The nose and respiratory organs are receptive of the action of medicines in fluid form by olfaction and inhalation through the mouth. So Hahnemann has told this in aphorism 284 6th edition. Then another is a footnote of aphorism 285, where Hahnemann writes about olfaction. Like he says that for this purpose it is most convenient to employ fine sugar globules of the size of poppy seeds, one of which imbibed with the medicine and put into the dispensing vehicle constitutes a medicinal dose which contains about 300 part of a drop. For 300 such small globules will be adequately moistened by 1 drop of alcohol, and this dose is diminished by laying such globule alone upon tongue and giving nothing to drink. And in sensitive patients it is most convenient to employ, if it be necessary in the case of very sensitive patient, to employ the smallest possible dose and bring about most rapid result. That is, he says that one single olfaction will also suffice, and with reference to note aphorism 288 also. So here, like what I employ in my clinical practices, we take a 1 gram phial of glass. We put a globule, like I usually give in LM potencies. So 1 globule, which is a poppy size, like it is told in this aphorism. So poppy size globule is taken. 1 gram of the glass phial is taken. 1 drop of water is put in that, and 1 globule is put in that. Now when this globule dissolves, we fill the phial 3/4 with alcohol, and now we tell the patient to take take this medicine through the olfactory route, as in we give strokes to this phial, like 10 strokes or 12 strokes or whatever is required in each case, ranging from 2 to 12. So as per the requirement of the case, we tell the patient to give strokes to the phial and then make an olfaction through the right nostril, then through the left nostril, and then again through the right nostril. So 3 times olfaction. We tell the patient to take this way in the morning, and again, like he had given right, left, right in the morning, so in the evening it will be from the left nostril, then right nostril, then left nostril. So this way we administer through the olfactory route, and this can be done similar to the oral route. Like if you are giving twice daily in oral route also, twice daily in olfactory route can also be given, and it can be continued for 1 week or longer also, as per the requirement in each case. Generally we tell for 1 week and then take a follow-up and then guide further. Now Hahnemann also talks about in the introduction to arsenicum in volume 1 of his Materia Medica Pura, and he writes about the olfactory route, and I'm just reading the red portion, the highlighted one. This is a mode for administering medicine which more recent very extensive experience teaches is greatly to be preferred in most cases to any administration of small globules by the mouth for the homeopathic cure of all chronic as well as acute diseases. So Hahnemann has greatly emphasized this method, and through extensive experience he has written this, that this method is very much to be preferred in many cases, preferred with comparison to the oral route, especially in sensitive patients. So this is, he has written in volume 1 arsenicum. If you open arsenicum in volume 1 of Materia Medica Pura, you will find this in the introduction part of arsenicum. Now, a sensible homeopathic, okay, I'm just reading the red portion now. But if owing to human fallibility, the selection has not been quite appropriate, one, two, or several olfactions of ipecac, hepar, sulf, or nux vomica, according to the circumstances, will remove the bad effects. So again, olfaction can be used for even in cases when there has been an inappropriate selection. So again, for antidoting also, like he has written about this olfactory route. Now this is a photograph from the introduction only, and here Hahnemann has written about the various diseases. Like he writes that such an employment of arsenic has shown its curative power in countless disease states, among the rest in several kinds of quotidian fever, agues, and etc. This entire paragraph describes various diseases in which the administration of arsenicum through olfactory route has been helpful. Now, olfaction means art of smelling, and it is a method of administering a medicine through the nose and mouth by the act of smelling. And Hahnemann was administering medicines by oral route for many years, but in his later years, from 1833, he has favored the olfactory route. He was giving through oral routes for many years, but later on he has favored the olfactory route as well, and he states in footnote of aphorism 288 in his 5th edition that homeopathic medicines act most surely and most powerfully when the medicinal aura that is always emanating from the medicine is inhaled for a short time. So he talks about inhalation, that is the olfactory method of administration. Now he tells about the method also. For this, the globules, like a single globule is moistened with medicinal fluid. Like as I told you, we take a 1 dram phial and put the globule and little water and then fill it with some alcohol. So the same thing he has written, that globules are moistened with medicinal fluid and placed dry in a small phial. And like this is another way that he talks about smelling by directly putting the globule also in a small phial, but this is generally not adopted. Like clinically, we use the method which I have just described, in a 1 dram phial with alcohol and dissolving the globule. Then the patient is allowed to hold the open mouth of phial first in one nostril, and in the act of inspiration draw the air out of it into himself. So only one globule is enough for making the medicine in olfaction, and then the patient is told to take olfactions through like right, left, right, and next dose is from left, right, left through the nostrils. Now, if it is wished to give a stronger dose, the patient is asked to inhale the same vapor with the other nostril more or less strongly according to the strength intended. Now, if nostrils are stopped up by coryza, polypus, then patient can inhale by mouth by holding the orifice of the phial in between the two lips. So that is through the mouth also the olfactory route can be taken. And then in children, it can be applied like we just keep the phial close to the nostril of the child while he is asleep, and then when the child breathes, the olfactory effect can go inside the nose and give a beneficial effect. So in little children, it can be applied close to the nostrils when they are asleep and with a certainty of producing a good effect. The medicinal aura comes in contact with the nerves in the walls of the cavities of the nose and produce a salutary influence on the vital force in mildest yet powerful manner. And remember that interval of repeating for olfaction is same as that of the oral route. If you are giving a twice daily dose, you can similarly give for olfaction also, that twice daily the medicine has to be taken through the olfactory method. Now this explanation is given by Hahnemann in aphorism 288 of the fifth edition of Organon. And he just tells what I've just told in this, that the medicine is taken in the form of vapor, and if the nostrils are stopped up, then the patient can inhale by mouth by holding the orifice in between the lips. And for children, the phial can be kept close to the nostril when they are asleep, and it produces an effect when the child breathes. Now, little about the preparation. Like in the Paris case books, we find that Hahnemann continued to use olfaction until his last days, and Dr. Crosserio, a close colleague of Hahnemann, has stated that Hahnemann gave an olfaction dose and waited 1 week. So this is recorded in Boningossen's lesser writings. In the 5th edition, Hahnemann recommends not to give the olfactory remedy any more frequently than one would give the dose by mouth. So in 5th edition, he has emphasized about the oral route, but in 6th edition, he has emphasized about the olfactory method also. So Hahnemann has used olfaction most exclusively for a period of time, but decided that oral medicinal solution was much more appropriate as a median dose. But olfactory method has its own importance, and oral route also has its own importance. In 248, 6th edition, he talks about the preparation and administration through olfaction, where he tells that 1 globule of the medicine should be taken, and if only a small vial, say a dram of dilute alcohol, is used in the treatment, in which is contained and dissolved through succussion 1 globule, just 1 globule is needed of the medicine, which is to be used by olfaction every 2, 3 or 4 days. This must also be thoroughly succussed. As I told you, we tell the patient to give succussions to the phial and then make an olfaction. And succussion can be done 8 to 10 times as per this reference. Before each olfaction, we tell the patient to give succussions similar to the oral doses which are given in LM potencies, in which succussions are recommended. So similarly, in olfaction also we recommend to give certain succussions before taking olfactory route, taking the medicine through the olfactory route. Now this is what I've already described. Take a pill, place it in a dram of in a 1 dram vial, then put a drop of water to melt the pill, then fill the vial with alcohol, leaving 1/3 empty, so that there is a gap for succussion. Then give succussions. Succussion can range 5, 6 times up to 12 times, 10 times. The hypersensitive may only need few succussions like 1, 2, 3, 4 succussion. Those having lower sensitivity can need more succussions like up to 8, 10 or 12 succussion. And medicine should be succussed always prior to the olfaction of the medicine. Then vial is then held under the nose and the vapors are inhaled by the patient. 1 dose is given to assess the sensitivity of the individual, and the remedy is repeated if and when necessary. Now in Organon, Hahnemann says that the dose can be repeated every 1, 2, 3, 4 or more days as per the need of the case. Now this photograph shows us about the procedure of olfaction. As you can see, the medicine phial is there. We take just 1 globule from the medicine and put it in an empty dram and fill it with alcohol. First dissolve it in water, 1 drop of water, then fill it with alcohol, then give succussions in this manner. You can also give the succussions over your palm of your hand, and then take the olfaction through right nostril or left nostril as per the need of the case. Need of the case, and you can repeat it like in the morning if the patient has taken from the right nostril, in the evening left nostril. Now olfactory method is used in the most sensitive patients and for patients having acute complaints like pains cases में. Now, specifically, you can use this method in idiosyncratic patients and when it is not possible to give the medicine through the mouth, like in cases during fit or epilepsy or hysteria, locked jaw, tetanus. In such cases where it is not possible to use the oral route, olfactory method is a beneficial way. Now, next method is the third method, which is application to the skin. Now, this has been given in 284 and 285 aphorism. Now, Hahnemann, as we all know that external applications are not very much, emphasized by Hahnemann. So Hahnemann, after his new discovery of homeopathy, he had proclaimed that external application is nothing but the external indication is nothing but the outward reflection of the internal derangement of the vital force, and the internal disturbance expresses through the symptoms over the external skin. So external applications are not really a strict principle of homeopathy, and treatment of diseases by internal medicine is the speciality of homeopathy. Basically, usually this method of external applications is not very much indicated, not very much advised by Hahnemann in much cases, and oral medicine is to be preferred because the diseases manifest by signs and symptoms, which are the sole guide for our treatment procedure. Because no disease is external or local, and the immaterial vital force throws out the internal malady on the external surface. The nature of external symptoms only indicate the nature of the internal sickness. So generally, we usually go for the olfactory method or the oral route. Okay, now removal of the external affections is never cure. But on the other hand, you just remove the external lesion and do not give the internal medicine. That way, it is not really curative. Because on the other hand, they may attack some vital organs on our body and in our body, and as a result, we rely on the image of the disease. But for accidental cases like injuries, lacerations, burns, we definitely need some local cleansing and dressing up of the part. So Master Hahnemann gives some arguments against the external application in his Organon of Medicine in aphorism 196 to 203. But later on, he saw the necessity also of the external application while advocating the administration of medicine per mouth. So he feels that oral route is not the only route for administration of medicine. He explains in aphorism 284 and 285 in his 6th edition about the use of external application, and he says that curative medicine should be continued internally along with the same remedy being used externally as an ointment, liniment, lotion, cerate, etc. So when you are giving the same medicine internally and applying the same medicine externally also, this really gives a beneficial effect in certain cases. Now, topical products which are applied to the skin, they stimulate a localized healing process, and these include like glycerols, ointments, liniments, opodeldocs, lotions, cerate, poultices, fomentation, plasters, sprays, oils, etc. Now, the administration of the medicine through the skin is done by two methods. First is the epidermic method, and then is the anepidermic method. This epidermic method is also called the rubbing or friction method. In this, the medicine is applied by friction through the cutaneous surface of the body, wherever the epidermis is sound, like epigastrium. Then you can apply the medicine over the abdominal area, epigastrium area, then inner parts of the thighs, lower part of the abdomen, back, arms, leg, testicles, labia majora, and application can be done of lotions, ointments, liniments over the unbroken skin. This is the epidermic route. Now, Hahnemann has also told this in aphorism 292 footnote, where he calls this method as the rubbing in method. he says that rubbing in appears to favor the action of medicine, and only in this way that friction makes the skin more sensitive and the living fibers thereby more capable of feeling, as it were, the medicinal power and of communicating to the whole organism this health affecting sensation. So through the rubbing in method, it is a beneficial way, and rubbing in can be done through various areas of unbroken skin. Second method is the epidermic method, and in this, drugs are simply kept in contact with the unbroken skin without friction or rubbing. So this is the difference between them. The first one involves rubbing, but epidermic does not involve any friction or rubbing. The medicine is just kept in contact. No rubbing is done in epidermic method. Like plasters, poultices, ointments, etc. can be applied through this method. Now, various external applications are used. Due to the limitation of time, I am not going into the much finer details of this, but I'll just enumerate them. Like various external applications are glycerols, ointments, liniments, opodeldocs, lotions, cerates, poultices, then fomentations, plasters, oils, injections, and surgical dressings. So these are various kinds of external applications which are used in homeopathy, and they have their details in the book of pharmacy. Now, rubbing in method has been described here, like I have just noted the aphorism footnote here, 284 6th edition footnote. He says that rubbing in on the skin is also told by Hahnemann in aphorism 284 6th edition, where he writes that the whole remaining skin of the body clothed with epidermis is adapted to the action of medicinal solutions, especially if the injunction is connected with simultaneous internal administration. So as I just told, that when you are giving an internal medicine, if you are using the same medicine externally, it gives beneficial effect. But the medicines should be same. Like if you are taking the thuja internally and applying thuja externally also, it will give a better effect. It will give a beneficial effect. But 2 medicines at a time is not recommended as per the basic principles of homeopathy. Now further, Hahnemann tells in aphorism 285 6th edition also, in very old disease. Okay, in this way the cure of very old disease may be furthered by the physician by applying externally, rubbing it in the back, arms, extremities, the same medicine he gives internally, and which showed itself curatively. In doing so, he must avoid parts which are subject to pain or spasm or any skin eruption. The parts having pains, spasm, and skin eruptions should be avoided for any rubbing in methods. Now, next method of administration is through the milk of the mother or wet nurse, which is given in aphorism 284 footnote 6th edition. And this method is the most peculiar, or I should say the most one of the most unique methods of administration, which is only in homeopathy. So homeopathy has a great scope for administration of the medicines to the infants, and for treating the ailments of infant, the medicine are administered in moderate doses to the nursing mother. So instead of giving the medicine to a small newborn infant, we tell the mother to take the medicine, because the child is on feeding. So when the mother takes the medicine, the effect of the medicine goes through the milk of the mother to the child also. This medicine can be easily and certainly utilized by the child through the milk of mother. And every rightly chosen homeopathic medicine administered in this way removes the ailments of the infants. Hahnemann has told this method in aphorism 284 footnote 6th edition, where he writes, the power of medicines acting upon the infant through the milk of mother or wet nurse is wonderfully helpful. Every disease in a child yields to the rightly chosen homeopathic medicines given in moderate doses to the nursing mother and so administered is more easily and certainly utilized by these new world citizens than is possible in later years. Continued to this, he also writes further, since most infants usually have imparted to them sora through the milk of the nurse, if they do not already possess it through heredity from the mother, they may be at the same time protected antisorically by means of the milk of nurse rendered medicinally in this manner. So this method also helps to remove the miasmatic influences which the child has inherited. So if in his early years his mother is prescribed a medicine, antisoric medicine, and the effect of this medicine goes to the child also, so it will remove the miasmatic influences also, and the child is protected from any future diseases. So this is a very good method of anti-miasmatic prescription just in the early stage of life, in which the child is protected from any future illnesses also. So this method is very much unique to homeopathy. Other methods are eye drops, ear drops, eye drops like Cinerea maritima, ear drops like mullein oil. Now few conditions for administration of the medicines are given in aphorism 246, 6th edition. The selected remedy should be homeopathic, similar. It should be potentized. It must be dissolved in water. The medicine globule should be crushed with sugar of milk, dissolved in water, then stirred and then taken. To increase quality, medicine should be stirred well before being administered. Then quality increase the greater the quantity of fluid is taken. For in this case, medicine will come into contact with larger surface of sensitive nerves responsive to the medicinal action. Then the dose should also be small. Every subsequent dose must be higher than the previous one, because the quality of medicine is increased when the succeeding doses are changed slightly every time. That is potentized somewhat higher on every repetition. Now this is because the former dose has already done the expected change in the vital principle, and the next dose does not find the similar condition. Hahnemann has told about this in 247, aphorism 247, 6th edition. Now the medicine should also be given at suitable intervals, definite and suitable intervals. General precautions are there for administration of medicines. Now it is preferable to take the medicine with a gap from the meals, like nothing should be taken half an hour at least before or after taking the medicine. It is recommended to refrain from taking the medicine at the same time the other medicines are being taken or any supplements are being taken, so that they do not interfere with each other. So the easy to follow rule is to make a gap of 15 minutes to half an hour before or after taking the other medicines like allopathic medicines or other medicines. Now it is recommended to refrain from consuming foods or drinks that contain strong aroma like coffee, peppermint at the same time when the medicine is being taken, so that it does not interfere with each other. Again, the same rule is applying here. You can take a gap of 15 minutes to half an hour before or after drinking, eating or brushing the teeth. Now everything that can hinder the action of your medicine should be removed from the diet and regimen of the patient, so that small doses may not be overwhelmed and extinguished or disturbed by any foreign medicinal irritant. This Hahnemann has written in aphorism 259. And no new habits or addiction should be indulged during the course of the medicine, and as much as possible the patient should refrain from any emotional stress, strains or excitements. Few things in brief about repetition are told in aphorism 245 to 256. The perceptible and continued progress of improvement contraindicates repetition. Repeat the dose only when improvement ceases. जब रुक जाए तभी next dose देना है. Now, repetition may be continued till either recovery ensues or different group of symptoms arise. This is in aphorism 248. In chronic diseases, medicine can be repeated at intervals of 14, 12, 10, 8 or 7 days. Now, in chronic cases resembling the cases of acute disease, the medicine should be repeated at shorter intervals. In acute disease, at very much shorter period, the medicine can be given at 24, 12, 8 or 4 hours, or even in very acute test cases, every hour or even up to every 5 minutes also the medicine repetition can be done. Now to conclude, I would just say that homeopathic medicines are palatable, they have no adverse side effects and can be administered very easily. The different modes of administered can be used for the treatment of various disorders on the basis of the principles of homeopathy, and each method has its own importance and can be applied as per the requirement of the case. The method of olfaction and external application hold importance for patients who have difficulty in taking the medicines through the oral route. For example, patients who are bedridden, palliative care patients, old individuals, infants, small children, they can be, in them the methods of olfaction and external applications are helpful. So with this, I would like to conclude, and I would like to thank the team of Homeopathy 360 for giving me this opportunity to share this topic with you all today. Thank you so much.
Thank you, Dr. Kaur. So we are open to question answer session. So if you have any questions on this topic or anything that you want to ask Dr. Manpreet, we're open to it. You have the chat box below where you can type your questions, or there's another option of Q&A where you can type your questions and we'll take up those questions. For now, Dr. Kaur, I'd like to mention you have mentioned two topics, miasms and external applications in this webinar. Regarding miasms, we'll take it up again in a little more detail, and that will also be for a clinical utility of miasms. So that will also include PG students. So we're inviting everybody. As soon as the dates are finalized with Dr. Kaur, we'll announce them. Most likely in 2025, we'll be meeting again. And
Sure.
Another topic was external applications. So very quickly, let me tell you, we'll be taking up this topic in detail with a pharmacy professor, and that would be in a day or two. And again, we'll announce as soon as it is finalized. For now, we have a number of questions, Dr. Kaur. So I'll begin with the questions.
Sure.
The first one is somebody's asking, how does the medicine reach the blood by nerves, through nerves? Because I
No,
think you talked about nerve absorption.
no, I was just saying that when you are taking the allopathic medicines, they are absorbed through the blood. But our homeopathic medicines act through the nervous system. They are utilized through the nervous system, through the sentient faculty of the nerves over your tongue, oral mucosa, and they are their effect is transmitted or absorbed in the body through the nervous system, not through the physiological method which is for allopathic medicines.
Because I think we're
In
also not talking about the material dose here. We are talking about dynamic doses. We're already potentized the medicine, so it's working in the energy levels.
Yes. So our route is different and the absorption method for allopathic or other medicines is different. Ours is through the nervous system and theirs is through the blood.
Another question is, will a drug that has been taken by olfaction only be antidoted by the drug which is taken by olfactory route, or we can mix the two?
It all depends on the case. How much is the aggravation? What is the next indicated remedy? Like for antidoting also there are various principles. If it is bearable, we just leave the patient on placebo. If it is unbearable, then we antidote it. So it all depends on what the symptoms the patient has manifested in the follow-up. It's not specifically that if you have given olfaction, then you can antidote through olfaction only, or if it's oral, then you antidote through oral route only. It's not specific. It's all related to what symptom the patient gives.
Which means point one,
Generally, we
it
do not.
varies from case to case. Yeah, and it also varies from situation to situation in the same patient.
Definitely, it varies. It varies.
Any more questions? Okay, how do we decide in which case should we give by olfactory route and in which case should we use another other methods and external applications and through oral route? Okay, so they want to ask कि how do we decide कौन से case में क्या use होगा?
See, the most common method is oral route. Olfactory route is more beneficial in case of pains or sensitive patients, or where the oral route is not possible. And external applications, personally, I am following purely classical and rarely using any external application. But external application can be used as written by Hahnemann. He has given an example of thuja in a footnote in aphorisms, where he writes that externally also you can apply thuja and internally also the same medicine to be given. Two different medicines should not be used, like one you take orally and one you apply externally. That is not good to do it, but the same medicine can be used. Again, it depends on the presentation of the case, requirement of the case, and which comes through experience only. When you sit in the clinic, see patients with your seniors or on your own, this you gain by experience, that which case requires external application, which case requires olfactory, and which case requires oral method. Most common is oral, but olfaction has its own importance, and external application also has its own importance.
Okay, another question is you said the skin should be unbroken when we use an ointment, but why should it be unbroken? Because ointment will only be used when there is a cut or a bruise or laceration or whatever. That's
Yes,
a very on point question.
yes,
Very logical.
that's true. That's true. See, it is just a reference from the organon only, that if the patient is requiring an external application, the areas where the skin is broken, the medicine should not be applied. But there are cases where there are like pains. You definitely, or you apply calendula to a wound. So there definitely the indication is different, na? That calendula is indicated for wounds. So surely the skin would not be unbroken in that case. So it again varies from case to case. In case of pains, you do not apply on unbroken area, and in case of lacerations, wounds, you definitely will apply to broken skin only. So both the things are given by Hahnemann in different aphorisms. Like I had just quoted also, in case of lacerations, wounds, and etc., the external applications are used. But on the other hand, external applications are also used where for other symptoms where there is no broken skin. But where there is no broken skin, then in those cases it should not be given where there are spasms or there are eruptions, which Hahnemann has written in the aphorisms. It's all from the organon only. Just go into the finer readings and you will find all the reference there.
Because this topic, the roots of drug administration, this is one of the very core topics of homeopathy. But in fact, that book, that was called Medicine of Experience, it is really true, because eventually, as you gain more experience in practice, we come to know a number of different things which are different from theory. So
Definitely, definitely.
okay, another question which I found is very interesting. Uh, this person is asking if medicines can work through mother's milk. Can they work even if given to someone through milk, through food, or any other drink? Because that is not advised.
No, as in an infant you are taking, like if you are expelling the milk of the mother and taking it that way, or uh, like here Hahnemann has just told that, like for example, I should explain this. Like if a child, like my teacher told this example once in our class, that the mother had suffered from an issue of anger in her family, but the child came with loose stools. The presentation was of the child, that child is having diarrhea. So other medicines are not acting, arsenic is not acting, other medicines are not acting. Now when they gave Staphylococcus aureus to the mother, the stools in the child got better. So this was the method. So how the ailment in the child got cured? By administration of the medicine to the mother, because taphysagria traveled through the mother's milk to the child and it cured, because the effect of the emotions of the mother also come into the child. Like for 7 years, or they say for 5 years, the mother and the child are connected. Whatever mother does, or whatever, you say for 9 months they are one unit, but no, it's not so. It's for around 5 to 7 years that mother and the child are connected. So there will be features like, there is a patient who was told by a pediatrician that mother was lot of worried and the child was having cold and cough which was not getting better. So the doctor told the mother कि आप परेशान मत हो, वो ठीक हो जाएगा, परेशान
Hmm.
आप हो, बच्चा परेशान
True.
नहीं है, वो आराम से दवाई खा रहा है. जैसे ही मदर ने खुद को ठीक करा, द चाइल्ड ऑल्सो गॉट बेटर इन 3 days. So there is a bond, and this method of administration is speciality, and it has its own uniqueness for homeopathy only. No other, I have not heard in any other methods, in any other systems
That's
about this
understood.
method of
Because I
administration.
think they go by the materialistic concept. So
Yes, yes.
obviously. Hmm. But what if we expel the mother's milk and then dissolve the medicine there and then give it to the child? That works the same way.
That is simply an oral route only. Like if you are not giving in water, you are giving in milk. That is a simple oral route. Then that is not the administration through the breast milk of the mother.
Hmm.
That will be simply, dissolving the medicine in a vehicle, not water but milk, and just giving through simple oral route.
And what this person is asking ki if it works with through mother's milk, so it should work with food and with drink. I think the case जैसे कि drug addictions में होता है, you want to de-addict तो आप किसी और चीज में मिला के दे देते हो, वो
Right.
वाला
तो
concept. But I think that
क्योंकि
doesn't work here because
यस, क्योंकि जब आप देखते हो, जब एक मदर अपने बेबी को फीड कराती है तो एक इमोशनल बॉन्डिंग भी इन्वॉल्व होती है. ऐसा कहा जाता है कि जब मदर अपने बच्चे को फीड कराए तो वो उसको एकदम शांत माहौल दिया जाए. तो उस टाइम जो बच्चा लेता है ना फीड, उसका एक अलग इम्पैक्ट पड़ता है. और जो आप मिल्क के अंदर दवाई डाल के सिंपली दे रहे हो, वो सिंपली ओरल रूट हो जाएगा. लेकिन जो मदर से वो डायरेक्ट आ रहा है, उसी समय आ रहा है, वो डिफरेंट रूट हो जाएगा. वो थ्रू द एडमिनिस्ट्रेशन, इट इज थ्रू द ब्रेस्ट मिल्क ऑफ द मदर. वो मेथड, मतलब एक वो ओरल रूट है और दूसरा अलग एडमिनिस्ट्रेशन थ्रू द ब्रेस्ट मिल्क है.
इसको
बिकॉज
sort of holism कि हम पूरे पेशेंट को कंसिडर करते हैं, ना कि किसी एक पार्ट को कंसिडर करते हैं.
Yes,
True,
yes, that
true.
bond and emotions are also involved when a mother takes the milk, when a child takes the milk from the mother during lactation
Hmm.
period. Lactation भी बड़ा important period होता है दोनों के लिए, बच्चे के लिए भी और मदर के लिए भी.
And initially, it used to be for 2 years at least. Now it
Yes,
has come down to just 6 months. But
yes.
true,
It
कि वो bond
is
तो it
it is
stays.
there due to the decreased in the lifestyles, and due to
हाँ,
decrease in the fertility
correct.
levels, the mindset of the ladies. Many things are changed. Many things are changed. External factors are also there: medications, environmental factors, lifestyle factors. So many factors are there due to this change which has come in the society now.
Okay, if there are any more questions, please type in the chat box. I think, Dr. Kaur, that is it. So let's wind up here, and I'll definitely look forward to the next meeting that we
Sure,
have, the next webinar on
sure.
clinical utility of miasms, where we'll be talking about more detail about miasms and how we utilize them in clinical practice and day-to-day affairs.
Sure. It's my pleasure to be meeting you again for another session. Definitely. Really thankful to the team of Homeopathy for today's opportunity and for the upcoming sessions too. I
Okay,
would.
before we wind up, sorry, yeah, sorry, go ahead, please.
I was just saying that I would be really glad to share another topic in the next session.
Yes, indeed, this topic was indeed insightful, very, very nicely taken, and we got a lot to learn. Uh,
Thank you so much.
I think I have received something. Okay, somebody. This is Shoaib Ahmed. He's writing awesome and marvelous webinar.
Thank you
Thank you
so
so
much.
much. Thank you so much. Dr. Kaur is indeed a wonderful teacher. So we'll look forward to having more conversations with her, more insightful conversations, and on more interesting topics. So before we wind up, I'll give you a very brief about what Homeopathy 360 is for those who have just joined us, or for those who are not aware of what is Homeopathy 360. Homeopathy 360 is a platform where we give space to every student to share their thoughts and to meet teachers, interesting teachers, and the most sought after teachers, the names that you've just heard. uh, you can directly speak to them through our webinar series, like Dr. Kaur, of course. And you have space for videos and for sharing all kinds of, for blogging, for sharing your thoughts. And that is what Homeopathy 360 is. It has been created for you, for all undergraduate students, where sharing of thoughts is sharing of knowledge. And with that intent, Homeopathy 360 has been built. And that is it. So we'll meet soon with the next webinar. And that will be, the next chapter will be tomorrow, but we'll be meeting Dr. Kaur in 25 now. Most
Thank you.
likely, most likely first week of January.
Surely, 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 definitely.
Yeah. Okay, thank you, everybody.
Thank you. Thank you so
Thank you,
much.
Dr.